Hello, everyone. I'm Natalie Kunzman, MD, and if you're asking why there is a lot of concern right now about off-label prescribing, I can't even give you the answer. I don't even know why this is a big concern, and the reason why I will explain. First of all, off-label prescribing, it does not violate any federal law. And even the FDA acknowledges this, as well as the Center for Drug Evaluation and Research, stating, and I quote, "Neither the FDA nor the federal government regulate the practice of medicine. Any approved product may be used by a licensed practitioner for uses other than those stated in the product label." And this can mean the use of medicines itself or medical devices for uses other than the initial indication that the pharmaceutical companies got approval through the FDA. It is, again, not illegal, and it doesn't constitute malpractice. I'm going to talk about many of the medications currently that we use off-label for many years. And am I doing it? Of course. There are many reasons why we do, and many of us have been trained by our mentors over the years, particularly those older than us that have seen a medication come out for a particular use, and then throughout the literature or throughout the practice has noticed some of the other benefits that go hand in hand with that medication. Now, in my mind, I would also venture to say that the decision to use certain medications in potentially an off-label using may be such a way to cut down what we call polypharmacy. So polypharmacy is, the laundry list of medications that some people may be on, and we want to cut down polypharmacy for obvious reasons, to cut down side effects, to cut down liver and kidney clearance, and so on. And if you can use some medications off-label, you may actually be able to use a medication for one purpose, but may be able to kill two birds with one stone. And one of them that I can think of off the top of my head might be an anxiety medication that literally came out onto the market to quiet anxiety, but this patient also has insomnia. So rather than have an anxiety medicine and a medicine that is FDA approved for insomnia, so rather than having two medicines, you might choose a medication that might be indicated for anxiety, but off-label is being used for insomnia. So in that way, we've killed two birds with one stone. Also, some of the off-label use might be actually more cost-effective, obviously cheaper, and affordable to a patient. So I can think of some medications that a brand came out on the market for, let's say, pain control, but its brother or sister is already out on the market, is already in a generic formulation, and was indicated for another use. So we are using that generic medication that is chemically biosimilar in an off-label use so that the patient actually has an access to a treatment versus the exorbitant brand new medication that is brand that just came out on the market. So again, I'm just giving a few examples of a lot of the thought processes of what goes on in a prescriber's mind when we're looking at the arsenal of medications out on the market and those that have a good track record of efficacy, a good track record of safety, now potentially generic and more accessible for a patient. and the possibility of killing a few birds with one stone. Okay, so let's start diving in to all those medicines, and a lot of these you may recognize. So I want to give a fair shake and a fair understanding of off-label use that currently is out there. So let's start with some of those medicines that we use for mental health conditions. So, Amitriptyline came out on the market as an antidepressant. Okay, that's its indication. Here are the off-label uses that we will use it for: insomnia and PTSD. Now there is clonidine. Clonidine also is used for usually mental health conditions. But did you know that we are using it for smoking cessation or excessive saliva production as a side effect from a certain medication? Gabapentin, this is a big one. Neurontin is also its trade name. It can also be used for alcohol dependence or social anxiety, and it's off-label using. Prazosin has been out on the market for completely other uses and now being used for PTSD or nightmares. So we also have Topamax. Topamax is now being used off-label for alcohol dependence or weight gain that is being caused by some anti-psychotic medication, or binge order, or bulimia. Trazodone. This is a super common antidepressant as it's indicated use approved through the FDA, and we use it many times for the insomnia condition. Okay, so let's talk about some other classes of medications. So we have some anti-seizure medications that have been approved through the FDA, but an off-label use might be migraine management or depression or some neuropathic type pains. A very common one right now is a class of medications called anti-psychotics, and an anti-psychotic is to literally quiet down psychoses, such as in conditions of schizophrenia. But we have found some off-label uses in Alzheimer's disease, autism, and attention deficit disorder. We also have other antidepressants that are being used for chronic pain, ADHD, or bipolar disorder. Here we go. How many of you are potentially using an antihistamine that came out onto the market for allergy management? But okay, one of these is Benadryl. How many of you are using it as a sleep aid to help you sleep? How many of you are using it within your asthma regimen? Okay, these antihistamines only came out for allergies, but we are using them often with the asthmatic patient. There are what I mentioned previously, certain anxiety meds, and they as a nature will calm and quiet, and therefore we will use them off-label as sleep aids. Now, there are some people who have GERD, and there is a type of medication called a PPI, protein pump inhibitor, that shuts down acid production. And it came out into the FDA approval for that particular condition. But how many of you might be using this for irritable bowel? Beta blockers, this is a big one. These guys have been out on the market for 40 plus years, and they have their FDA approval for high blood pressure and heart disease. But how many of us have used them for migraine management, heart rhythm disorders, or anxiety? A beta blocker to aid with the anxiety phenomenon and essential tremors. Okay, Metformin has been on the market for a long while, and it is FDA approved to help with sugar and diabetic management. So I'm sure a lot of you type 2 diabetics are very familiar with this fantastic insulin sensitizer, and in regards to the way that it works at the liver level, quieting down gluconeogenesis. Well, it is being used ubiquitously in the management of hirsutism, which is hair growth, acne, and insulin resistant in a PCOS patient. So it's being used for its anti-androgenic effects, and it is also being used to improve ovulation in a PCOS patient, especially when it's used with Clomid. And don't forget, its FDA indication is for diabetes, but it is used for these other purposes. And again, this is not to criticize. This is just to say how robust and how wonderful certain medications have alternative uses, extra uses, and more benefit to the patient the longer we use them over time. Here's another very, very common medication that is used for multiple things. Gabapentin. Okay, so Neurontin was its brand name. Now, it has been approved through the FDA for seizure activity in ages 3 to 12 and in adults. And currently, we are using it for pain management. We use it for restless leg syndrome. And it's also being used to assist people that are recovering from abuse with drugs and alcohol, because a lot of times it can help control withdrawal symptoms from alcohol, from benzos, from opiates, from cannabis. And interestingly, it also, in some people, can reduce cravings and anxiety. And think of all those wonderful uses that we've gained out of an anti-seizure medicine that I venture to say is hardly ever used for seizures anymore. Okay, a few more, and I don't want to belabor the point, but these are very common, and you need to know how harmless it is for off-label prescribing. There is Singulair. Okay, so Singulair might be used for asthma and allergies, because that's what its indication has been for. But there are people using Singulair for COPD and eczema. Botox. Okay, how many of you have potentially used Botox for its two FDA purposes? One is the wrinkle reduction, and the other is excessive underarm perspiration. However, it also gained some approval to treat some stroke-induced muscle spasms in the arms and the head. However, now we have some off-label using quite frequently to treat the headache phenomenon, muscle stiffness, CP, and again, has FDA approval for one thing, used for another. Adderall has been approved for attention deficit disorder, and I think a lot of us understand that's use, but as its side effect profile or side effect of the medication, it can cause weight loss because it quiets down the appetite. So it is being used off-label for childhood obesity to help manage obesity in children. And I've actually seen it starting to be used a little bit more for binge eating disorders in adults. Now, Topamax, that has been medication that has been FDA approved for headache, and it is an anti-seizure medication. But now Topamax is used a lot for mood stabilization, treatment of alcoholism, weight loss, and it can behave as a pain management strategy. Okay, folks, there you have it. I don't want anybody falling into the fear right now surrounding off-label use for very safe medication for an alternative purpose. Sometimes we are getting confused by the English terminology of how we classify something, but when we dive into the chemistry on the mechanism of action at the cellular level or at the organ level, these medications can be used wonderfully for alternative purposes when researched to do so. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.